Grindelia, Allen's keynote. On falling asleep, the respiratory movement ceases and is not resumed until he wakes up from the state of suffocation. Fear of going to sleep on account of loss of breath which awakens him. Humid asthma from catarrhal bronchitis, cardiac asthma, wheezing and oppression of breathing in bronchitic patients. Asthma with profuse tenacious expectoration which relieves. Bronchoria, much tenacious mucus which is difficult to detach. Emphysema with dilated heart. After getting quiet, just as he would commence to lose himself to sleep, he would suddenly awaken again because he seemed to have forgotten to breathe. Must sit up to breathe. Cannot breathe when lying down. Keynote respiration. Wants light in the room all night. Dyspnea or something on falling asleep. To cover this symptom, we have also the following remedies: ammonium carb, antimtart, bryonia, carbovage, graphitis, lachesis, nux moschata, opium. Pruritus of the vagina and the vulva, whether from leukorrhea or aphthy or of venous origin. Unbearable pain in the region of the liver and the spleen, too severe that he cannot lie still a moment. Traumatic iritis, purulent ophthalmia, herpes zoster, ulcers with swollen purple skin, potency 30-200. Grindelia, Homeopathic Materia Medica, rosin wood. Both Grindelia robusta and Grindelia squarrosa have been used for the symptoms here recorded. There is practically no difference in their action, although the G. squarrosa is credited with more splenic symptoms, dull pains and fullness in left hypochondrium, chronic malaria, gastric pains associated with splenic congestion. Induces paralysis beginning in extremities. Its action is shown on the heart, first quickening, then retarding it. Acts on the cardiopulmonary distribution of the pneumogastric in dry catarrh. Produces a paresis of the pneumogastric interfering with respiration. Smothering after falling asleep. Asthmatic conditions, chronic bronchitis. Bronchoria with tough mucus, difficult to detach. Raises the blood pressure, nausea and retching of gastric ulcer, sugar in urine, an effective antidote to rust poisoning locally and internally, also for burns, blisters, vaginal catarrh and herpes zoster. Hyperchlorhydria when attended with asthmatic and other neurotic symptoms. Hyperemia of gastric mucous membrane with difficult respiration. Head feels full as from quinine, pain in eyeballs, running back to brain, worse moving eyes, pupils dilated, purulent, ophthalmia and iritis. Respiratory, an efficacious remedy for wheezing and oppression in bronchitic patients. The sibilant rales are disseminated with foamy mucus, very difficult to detach. Acts on the pulmonary circulation. Asthma with profuse tenacious expectoration which relieves. Stops breathing when falling asleep. Wakes with a start and gasps for breath. Must sit up to breathe. Cannot breathe when lying down. Pertussis with profuse mucus secretion. Bronchoria with tough, whitish mucus expectoration. Sibilant rales, weak heart and respiration, cannot breathe lying down, keynote respiration. Spleen, cutting pain in region of spleen extending to hips, spleen enlarged, skin, rash like rosella with severe burning and itching, vesicular and papular eruptions, herpes zoster, itching and burning, poison oak, ulcers with swollen purplish skin. Relationship compare tartar emetic, aerodictyon, lachesis, sanguinaria. dose. Tincture in 1 to 15 drop doses also lower potencies.